Hello, everyone, and welcome to this evening to this webinar. I think that we can start, and assuming that there is no one else coming, but we will see in case they can just join us at any point. So this evening, this evening is dedicated to our vulnerable friends. Means that all the small fairies, parrots, and reptiles that start to aging, so they need some extra care. And this evening, we are going to see together which are the possible options that we have to make their life easier as possible and still enjoying their company. But first of all, I would like to obviously a heartfelt ciao to Herbie that left us a few days ago. So I just want to obviously tell him that now he can eat many banana slices that he wants. That was his preferred treat. So hopefully he will be happy. How was before, but even more with all the bananas that he wants, without no restriction for his diet. And for those who don't know me or haven't followed the previous webinars, let me introduce myself briefly. My name is Gianluca, and I'm a veterinarian who deals with exotics, zoo, and zoo animals. I'm particularly passionate about topics such as welfare and husbandry. And I created this series of webinars to try to bring the world of veterinary medicine to a level that is understandable for everyone. We have already covered several topics, and many will be added in the following months. So this is the question. So at what age can we really say that our animals are old? The answer is obviously never, never. They don't age, they never change, they are and always will be our friends with fur, feathers, and scales. But the reality that we must deal with sooner or later is that at a certain point, they will start to run less, not jump as much as before, and require more care and attention. So what can influence its onset? So we must, for example, this could be related with the species or the breed. There are some breeds that are more predisposed to have, obviously, aging sooner, or at least aging not in the right way. There could be inherited or genetic factor that can obviously make these problems occurring sooner. The husbandry has definitely a great impact on the welfare and their quality of life, especially when they start to be older. Sex, not really, but sometimes this can be, for example, related with disease pathologies that are sex related. So yes, this can affect at some point. And the attitude. So if it's obviously a rabbit that was in use to run a lot, or was a more lazy one that was spending much more time on the sofa. And we must also, however, take into account that life expectancy has increased considerably compared a few years ago. If you think that at the beginning of the 2000, the average life of a rabbit was around 5 years, and today we are close to 12, even 14. And like small mammals, reptiles and birds have also benefited from a considerable lengthening of their life, thanks also to greater knowledge regarding diet and management, and to advancement of veterinary medical care, with more and more veterinarians oriented to the care of these animals. But this has also brought with it an increase in problems. While it is true that the treatments have improved and we have drugs available that we did not have until recently, this has led to an increase in age-related pathologies. The onset of, for example, neoplasia or other pathologies that sometimes did not have time to manifest themselves because the life was quite short. So now that a rabbit can live obviously so much longer, there are also much more chances that it can show this disease. And if I'm asking you how old these animals are, Are you able to answer, to tell me exactly how old they are? Unfortunately, not. I can tell you that the eagle, the one on the left-hand side, is 28 years old. The pheasant, the second one, is 16. He even lived more than expected, because usually the life expectancy for the golden pheasant is 12 years. So 16 is definitely much longer. And here we have 3 tortoises. The first one is a sulcata, that is 26 years old. Then we have this is a wild one that I found in the wild when I was working in the field in Italy, and is probably estimated 7 years old. And the last one on the right-hand side is, for this one we exactly know how old she was 92 years old. And now is even older, because I saw that was probably 8 years old. 6 years ago, sorry. So, but just looking at them, you are not able to tell them how old they are. But what are the pathological conditions that can arise more frequently with advancing age? It's worth noting that many of these are painful, progressive, and not curable, which means that sometimes we have to find the right balance between the well-being of your animal, or my patient, in my case, and what is actually possible to do. It is always worth trying and seeing what the response is to the therapy, which can be pharmacological or surgical, and decide on case-by-case basis. So not all the animals are the same, so they can also react in a different way to the treatments that we are planning to start. From a medical point of view, we often find ourselves faced with a dilemma of what is the best choice. And sometimes we have also to rely on the therapy that is called palliative. Means when there can be no resolution to the problem, and therefore we try to make our patient lives as more comfortable as possible. And also the life of the owners, because we have to consider also that there is a bond and a relation between obviously you and your animals. And speaking about the disease, obviously an example could be the osteoarthritis, that can be quite a subtle disease, and I will show you later some X-rays of patients with osteoarthritis, just to give you a glance on what could be. And most of the time, rabbits or guinea pigs, or even other animals, they are not showing a lot of signs when they have this disease, because it's a very slow occurrence. So sometimes they are unused to that pain, but this doesn't mean that they are not in pain. Cataract and glaucoma, these are 2 diseases that are also quite common for us with the age, and obviously they affect the eye. The cataract itself sometimes is not very painful, but it could be when the intraocular pressure, so the pressure inside the eye, start to increase and then take the name of glaucoma. And this could be quite painful. And again, many rabbits or guinea pigs can be affected by glaucoma, but they are not showing us most of the time signs of their discomfort, their pain. Pododermatitis, another condition especially common in animals that live indoor. These can affect also parrots that, for example, spend too much time in a cage on the perch. So putting all the weight on the legs on a perch that is not suitable for their feet can predispose to this problem. Tortoise too, because tortoises that living, for example, on a hard surface like concrete, they can start to develop at some point pododermatitis. Urinary problems, these can be obviously characterized by the formation of stones, urolithiasis, so the stones in the kidneys, in the bladder. And again, these are conditions that are very painful. It's very painful for us. Why shouldn't for them? And incontinence. The incontinence can be related with urolithiasis, because when the patient is in pain, discomfort, sometimes can also obviously lose some urine, or could be also neurological. So for other problems alongside the urinary system, also like neurological problems that can cause the incontinence, urinary incontinence. Gastrointestinal disbalance, we know very well our small ferries, how they can obviously develop gastrointestinal stasis or gastrointestinal problems. And this is mainly related with the age, with the fact that the flora in the gastrointestinal tract don't work very well. So also minimal changes, not just in the diet, but also in the husbandry, can affect these even much more. Dental and ear problems. These can be, these two problems, for example, are related with the breeds, with the selection, and lop rabbit are the ones that are more susceptible to these problems. Are not, unfortunately, the only breeds, but are the ones that unfortunately suffer more for this condition. And in general, animals that are older are more susceptible to disease because the immune system starts to be weaker. And with the weaker immune system, bacteria, virus, fungus, or even parasites can have much easier life and obviously cause much more problems. And then we have also gout that could be considered and included in the urinary problems. I didn't mention during then, just because the gout is more affecting reptiles and birds, and because they have a metabolism and production of uric acid that is not present in small mammals, we can consider like as a different problem. But also the gout can be very painful because can affect the joints or also even the internal organs. So it's another condition that, again, is very common in captive birds and reptiles. And some factors that can increase the severity of the problems are, just to mention few of them, could be, as I said, husbandry. Think a rabbit or a parrot that are living all their life in a cage. I mean, the muscle can be weaker and the bones can start to suffer with age, much more respect a rabbit that is doing a proper activity or a parrot that is flying around. And this is linked to the lack of exercise and enrichment, because also the boringness can affect the immune system. So it means that if we relegate our animals because we are concerned, because he's older, so he should move less, we are sometimes doing worse. As I say, the breed and the immune deficiency also can predispose all everything we said until now. And what can we do at this point? We can consider using a dual strategy, which does not exclude one from the other, but rather if implemented at the same time can maximize the results. Means that at home and at the vet, we can try to find the right combination. And what can we do at home? We can start by changing the lifestyle. Ours, because sometimes we have to make drastic changes to our home and that of our pet. We can, for example, provide a good environment. And as we can see, this is a video of Herbie when obviously he was moving a little bit less, so he needs to have an assistant. And the vet bed, Incopad, or blankets can make the movement around the house much more comfortable because the surface is less slippery. So he wasn't struggling and losing balance. Also can reduce the damage on the feet, speaking about the pododermatitis. We should avoid stairs and ramps, or ramps that are too steep. Sometimes a ramp could be anyway helpful for them. So depend, again, how steep is the ramp. And as in the picture here, we can lower the little tray. So it means that the rabbit doesn't have to jump in the little tray, but can access to it much easily. Because sometimes what could happen is, oh yes, my rabbit is incontinent and urinate all around the house, or my guinea pig, but he has a suitable little tray that can access easily. No, it's quite high. Yeah, probably he's urinating around or doing his, not going to the toilet properly, just because he's not able to access the toilet, the little tray easily. The hygiene. So we, most of the time, pets that are not moving well need some assistance to cleaning, because if the results are concomitant osteoarthritis, obviously they are not able to groom themselves. So we have to sometimes also gently bath. We don't have to soak the rabbit in the water, as we can see sometimes in some videos online where the rabbit is swimming in the pool or in the bath, but just gently wash with warm water and then dry first with a towel, and then probably try to don't use straight away the air dryer, because it could be too stressful, too traumatic for the patient itself. And also the food should be easily accessible, as Herbie was offered some food very close. So the bowls should be with foods like greens, nuggets, and even the water should be closer as possible where they live. And what can help sometimes is also keep a diary, especially with the weight, because most of the conditions that I mentioned earlier are specific signs. But one sign that could be common for all of them, or most of them, is the weight loss. So if we know that our animal is losing weight, and again, this is a universal rule for small mammals, reptiles, and birds, we know that also if he's eating fine, there are probably other conditions underlying. So this could be a good reason to, keep a closer eye and see what is going on, because probably he's not moving enough, he's not reaching the food, or is not able, again, to eat properly for dental problems. As I said, we have to keep them active with enrichment, for example, the scatter feeding, just to keep active the foraging behavior. As you can see, this is still Herbie. I use a lot of video and picture of Herbie. And for that, I thanks Miss Boxall to give me the chance to use them. And as you can see, he was literally at some point, he was walking around, and means that obviously he was quite possibly in pain, discomfort, or was just adapt to move better as possible. And also the other thing that you can see here has been the garden have to be secured. So in areas where you suspect that he can jump or fallen, you have to put some covers, or in this case was bamboo or anything else that can avoid them to jump over or fall over them. Also, it wasn't a very high step, but again, considering the age, could be already quite a lot. Overweight and obesity, this is connected with what I was saying earlier about the weight, because if they're older, they tend also to move less, and then they can start to put on weight. And an excess of weight can also overwhelm the joints. And as you can see, is all related. And also the overweight is linked with the increase of chances to develop urinary problems like stones or sludge in the bladder. Sometimes physiotherapy can be helpful, can prevent the stiffness, and can help to building up muscle mass, but have to be under vet guidance. So don't start to do exercise before knowing what is going on underneath, because as I said, they can hide signs. So it looks like that your rabbit is perfectly fine, and then you can probably do some movements that wasn't appropriate in that specific condition and situation. So vet checks are the next step. And just to show you also, this is the video of Clementine. She's 12, and as you can see, she's still quite active. She had a lot of enrichment. She can do literally everything she wants around the house, literally more or less destroying everything is possible. As you can see here, you can see that he had obviously cataract related with the age, and also the other problems that we can see in just a few seconds will be, see, she can jump around, and here I pause again. It's not very clear from this perspective, but you can see that there is a little bit of asymmetry on the face, and this is because she had also ear problems. And we discussed about this in our previous webinar. So at the vet practice, what can we do? We can obviously plan from a medical point of view, as it works for us people, once we reach a certain age, the advice is to intensify the checks, even every 3 months, if could be considered necessary. Sometimes, depending on the medication used and the underlying medical condition, this check must be carried out every 3 months, for example, for dispensing some drugs that are controlled drugs. And a tailored MOT have to include blood tests to check kidneys and liver, urine to see if the kidneys are working, and usually we can combine the results, blood and urine results, to have a more clear picture of what is going on. Then we can also, depending on the situation, decide to take an ultrasound if we want to check the kidneys, has the picture as you can see on the bottom. An X-ray if we have to check the spine or the presence of stones, and or even a CT scan if we want to have a more clear investigation and deeper investigation. On the picture on the bottom left, what you can see is was still Herbie, if I remember right. I could be sorry if I make a mistake, but as you can see here was a quite severe pododermatitis, and this was a quite easy way to try to minimize the impact and reduce also the discomfort, because in this way this sort of pad underneath can reduce the pressure on the area. And I put the picture also an iguana where we were taking an ultrasound or a corner to check the heart rate and the chest, and to his routine health check, just to show you that any animals can be checked. And because he's an iguana doesn't mean that we shouldn't take an X-ray or an ultrasound. And speaking about X-rays, on the top left, here you can see this is an X-ray of a young rabbit, and you can see the space between the vertebrae. You can see that there is a black space. This space is normal. What is not is the picture beside, where I put with the green arrows, the space that looks fine, and with the reds, you can see that there is like a sort of bridge, are called also parrot's beak or are osteophytes. So these are the signs of the osteoarthritis, sorry. And these can develop with the age. And as you can imagine, they can make the spine more stiff, and any movement could be much more painful. On the bottom left, this is not contrast, but is the urinary bladder full with the sludge, with a very radio-opaque content. And these on the long term could be painful, first because it's quite heavy, and also because the material inside the sludge can irritate and inflame the wall of the urinary bladder. On the bottom right, instead we have the X-ray, the lateral X-ray of the spine of a snake, where you can see all these bumps and also a fracture where is the red arrow. This is a osteosarcoma, so it's one of the worst and more aggressive neoplasm that can occur and can affect also snakes. And in this case, because there was any treatment possible, obviously we opt, especially also because there was a fracture of the spine, we sadly opt for the euthanasia. But this is to tell you that, yeah, we can do whatever we want, but sometimes we have to put the welfare and the quality of life of our animal first. And in this case, there was anything that can help him. And then what we can do, I mean, for example, if I have a patient with joint pain to chronic osteoarthritis, whatever it is, a rabbit, parrot, or a tortoise, I want to prescribe a drug that will make them feeling better and means feel less pain. But my patient is also elderly. So without a blood test, it would not appropriate to prescribe meloxicam, for example, because there is a high possibility of a kidney problem, nor paracetamol if the liver is struggling to work. Remember that all substances, drugs, and other meds pass through these organs, kidneys and liver. So if they are not working well, their functionality will also be reduced. And I will therefore have to choose a medicine that is more kidney liver friendly. So if I know that, I will more keen to choose something that is safer. This underlines how important it is not to start DIY treatments, because we do not know if the kidneys or liver are healthy. So some drugs will be contraindicated, or if they require specific supplements. Because yes, we can give also painkiller, but probably they need also, if there is a liver problem, we have also to help the liver to working better, considering that we are giving something that potentially can damage it. When given once, and the other thing I already mentioned, the physiotherapy, there is also the laser therapy that sometimes can help, because it's literally relaxing the muscle, and this associated with the physiotherapy is doing a very great job. And acupuncture, this is a branch of the veterinary medicine that started to develop in the last few years, but there are already some studies that prove that acupuncture can work also with this animal. The problem is we have a lack of response, so we don't know how much is working. For us, it's working, but because you can ask, obviously a GP can ask to his patient, are you feeling better or not? And so on our patient, especially the smaller one, could be more tricky to understand how they are reacting and if this is beneficial or not for them. For sure, if it's done by qualified vet, acupuncturist, is safer. What we should avoid to do is think that this is safe. I found this on a Facebook group a few days ago, and I thought that was perfect for this evening to show you. And the thing is, I found this technique very painful, especially this, because they are very prone to break the spine, bones. So it's probably not advisable to do this. Okay, so and it could be very, very dangerous. There has been, if I remember right, here in England, few cases of a chiropractic that was working on dogs, and he damaged irreversibly the spine of these dogs, and then the only option was the euthanasia. So, is from a veterinary point of view, yeah, he's clapping his hands, but I don't think so that the rabbit is very happy. Has been lucky in this case, say that, but probably I'm not trying to do that. But apart all these things, there is anything else that we can do? So there are any miracle supplements that can avoid, for example, that osteoarthrosis can occur? So there has been few studies in guinea pigs that show that when given once a day from an early age, glucosamine and chondroitin sulfate has been seen that they are protective and prevent against the development of osteoarthritis, but as the study state, they literally have to be started since the guinea pig is very young. And so they require a very high commitment. And this is just on the guinea pig. So we don't know what happened in rabbits, or if the same is applicable to parrots or tortoise. And then the take-home message for today is literally adapting the house to suit your pet. So don't be selfish. Think that they are coming first. Monitor the weight. Again, remember, this is a golden rule to always monitor the weight. my advice is to at least once a week, even more frequently if needed. Avoid DIY because meds can help, but they can also kill. Probably not immediately, but they can obviously make the situation even worse. And again, the most helpful advice is probably have periodically vet health check every 6 months, 12 months, or as I said, even more frequently, like every 3 months, in case we need to dispense any other drugs that we cannot, we vets, we cannot without reassess our patient. So